If you're a man over 60, you've probably noticed your body doesn't respond the same way it did at 30. Maybe erections take longer. Maybe sensation has changed. Maybe recovery time has increased. That's not failure. It's biology. But here's what frustrates me. Most doctors never have an honest conversation about how to adapt your intimate life, including self-pleasure, to these natural changes. They'll prescribe medications, they'll check your testosterone, but they rarely sit down and have the nuanced discussion about context, adaptation, and balance that men at this age actually need. I'm Dr. Bennett, and I've spent 3 decades helping men navigate health in later life. Today, I want to talk about something that affects nearly every man, but rarely gets discussed with nuance. How your private, intimate habits fit into your overall health picture after 60. This isn't about telling you what's right or wrong. It's about understanding context, recognizing patterns that might need adjustment, and making informed choices that support your well-being. No scare tactics, no moral judgments, just honest information. Before we begin, if you value straightforward health conversations, subscribe and turn on notifications. Type 1. If you're ready for honest information without judgment. Let's start with the biggest factor most men don't consider. Context 1. The loneliness factor. I met with a patient recently, let's call him Robert, who mentioned something during a routine checkup that concerned me more than anything about his physical health. When I asked about his social life, he paused, then said, "Doctor, I live alone, retired 3 years ago. To be honest, I haven't had a meaningful conversation in weeks, but I'm managing fine on my own." 2. That phrase, "managing fine on my own," is one I hear often from men in their 60s and 70s. And while self-sufficiency is admirable, there's a difference between healthy independence and isolation disguised as self-reliance. Here's what research clearly and consistently shows. Social isolation significantly impacts health outcomes in older adults. Multiple large-scale studies have documented that chronic loneliness and social disconnection are associated with increased mortality risk, elevated blood pressure and stress hormones, weakened immune response, higher rates of depression and cognitive decline, and increased inflammation throughout the body. The concern isn't about what you do in private. It's about what that behavior might represent in the larger context of your life. If self-pleasure has become your primary source of comfort, connection, and stress relief, while you're simultaneously withdrawing from social engagement, that overall pattern deserves attention. Human beings are fundamentally wired for connection. Physical touch, meaningful conversation, shared experiences. These aren't luxuries or optional extras. They're biological needs that affect everything from your hormone balance to your cardiovascular health to your cognitive function. When solo intimate activity becomes a replacement for human connection rather than a complement to it, you may be missing out on health benefits that no amount of private activity can provide. Oxytocin release during social bonding, the cognitive stimulation of conversation, the cardiovascular benefits of feeling valued and connected. These come from interaction with others. Ask yourself honestly, over the past year, am I avoiding social situations more than I used to? Have I stopped reaching out to old friends? Am I declining invitations because it feels easier to stay home alone? Do I go days or weeks without meaningful face-to-face interaction? If your answer to several of these is yes, that's worth examining, regardless of what's happening in your private life. The solution isn't necessarily dramatic. It might be as simple as calling one old friend this week, joining a community group, even online, saying yes to the next invitation instead of automatically declining, taking one small step back toward connection. Your intimate life, whether solo or partnered, should be part of a rich, connected existence, not a substitute for one. Context 2. Your body has changed, and that's okay. A patient in his early 70s came to me with chronic wrist and hand discomfort. We ruled out arthritis as the primary cause, carpal tunnel syndrome, and other common conditions. During our conversation, I asked about his daily activities, including any repetitive motions. After some initial hesitation, he admitted he'd been experiencing discomfort specifically after self-pleasure. The revelation itself wasn't surprising. What struck me was his next comment. "I've been doing it the same way since I was in my 20s, Doc. I never thought about changing anything." And that's exactly the issue. At 72, his body was fundamentally different from his body at 25. But his approach hadn't evolved at all. This is simple biomechanics that applies to every activity. As we age, several predictable changes occur. Tendons and ligaments lose elasticity and flexibility. Joint cartilage thins and provides less cushioning. Skin becomes more delicate and tears more easily. Circulation becomes less efficient, and recovery from any strain takes longer. These changes affect everything we do, from typing on a keyboard, to gardening, to playing sports, to intimate touch. Acknowledging them isn't defeat, it's wisdom. The principle is straightforward. What worked for decades may need intelligent modification now. This isn't about stopping anything. It's about adaptation that prevents discomfort and potential injury. Here are practical considerations. Vary your approach. If you've used the same hand position and motion pattern for decades, introduce variation. Alternate hands if possible. Change angles and positions. This distributes strain across different muscle groups and reduces repetitive stress on any single area. Use proper lubrication. As skin becomes more delicate, friction that once caused no issues can now lead to irritation or microabrasions. Quality water-based lubricants reduce friction significantly. This isn't a luxury, it's injury prevention. Allow adequate recovery time. Your tissues need time to repair micro-stresses from any activity. For most men over 60, spacing intimate sessions 48 to 72 hours apart allows complete recovery. You may find that with proper recovery, sensation and satisfaction actually increase. Pay attention to positioning. Avoid positions that create sustained pressure on any single area, particularly the perineum, the area between the testicles and anus. Poor positioning can compress nerves and blood vessels, leading to temporary numbness or long-term discomfort. Listen to discomfort. Pain, soreness, or persistent discomfort after activity is your body communicating that something needs adjustment. Don't push through it or ignore it. Treat it as the valuable feedback it is. Think of this like updating your exercise routine as you age. You wouldn't do the exact same workout at 70 that you did at 30. You'd modify intensity, duration, and technique to match your current capabilities while still maintaining fitness. Your intimate life deserves the same intelligent, respectful adaptation. There's no shame in adaptation. There's only the wisdom of respecting where you are now, rather than clinging to where you once were. Context 3. Neurological patterns. I've worked with several men who maintain normal function during solo activity, but struggle with partnered intimacy. Blood flow is fine, hormones are adequate, but there's a disconnect. Here's what happens. When arousal becomes consistently associated with very specific circumstances over many years, particular visual content, specific touch patterns, precise timing, your nervous system can become highly calibrated to those conditions. This isn't a moral judgment. It's neuroscience. Your brain adapts to what you practice most. If that practice has been highly specific for decades, your arousal response may not generalize easily to different contexts, like the unpredictability and interpersonal complexity of partnered intimacy. The good news, Neural patterns can be modified through deliberate practice. Introduce variety into your solo experiences. Engage multiple senses. Practice presence and awareness rather than relying on familiar formulas. This kind of neurological flexibility serves you well in all areas of life, not just intimacy. Context 4. Hidden health indicators. Something important that many men don't realize. Erectile function often serves as an early warning system for cardiovascular health. The blood vessels serving the penis are smaller than those serving the heart, so reduced blood flow shows up there first, typically years before cardiac symptoms appear. If you notice that solo function remains intact but partnered intimacy becomes difficult, that's not necessarily psychological. The cardiovascular demands differ. Solo activity typically involves less exertion, lower heart rate, less sustained effort. This pattern doesn't mean the activity is causing problems. It means your body may be giving you valuable diagnostic information. If you notice this, it warrants a conversation with your physician about cardiovascular screening, not embarrassment or avoidance. Early detection of circulation issues allows for intervention. Lifestyle changes, medication if appropriate, that can prevent serious events down the line. Your body is communicating. Listen to it. Context 5. Posture and pelvic health biomechanics matter. The position you're in during any activity affects your body's long-term health. This is true for sitting at a desk, sleeping, exercising, and yes, intimate activity. Sustained pressure on the perineal region can affect the pudendal nerve, which provides sensation to the genitals. Poor positioning during any extended activity, cycling is the most studied example, can lead to discomfort or temporary numbness. The solution is simple awareness. Avoid positions that create sustained pressure on the perineum. Choose positions that distribute weight evenly. Use cushioned surfaces when appropriate, and take breaks during extended sessions. This isn't complicated. It's basic ergonomic consideration applied to intimate activity. Context 6. Emotional complexity. I've spoken with men who've realized that self-pleasure has become their primary tool for managing difficult emotions. Anxiety, loneliness, boredom, stress. Using physical release for emotional regulation isn't inherently problematic. Orgasm does temporarily reduce stress hormones. But when any single behavior becomes your only coping mechanism, you lose emotional resilience. Life after 60 often brings real challenges: health concerns, financial worries, loss of purpose, grief. If your only tool for managing those feelings is sexual release, what happens when that tool becomes less effective or less available? Healthy emotional aging involves having multiple strategies. Maintaining social connections, engaging in physical activity appropriate for your abilities, finding meaningful pursuits and hobbies, and seeking professional support when needed. The goal isn't to eliminate sexual activity as a form of stress relief. It's to ensure it's one tool among several, not your only one. Context 7. Belief systems and shame. Many older men carry decades of messages about sexuality being shameful, weak, or wrong. These beliefs don't disappear with age. They often intensify as men have more time to reflect and may face religious or cultural guilt about desires that persist into later life. From a health perspective, chronic shame has measurable negative effects: elevated stress hormones, suppressed immune function, increased risk of depression and anxiety, and in severe cases, even suicidal ideation. Whatever your beliefs, carrying toxic shame about normal human biology causes real harm. Sexual desire doesn't have an expiration date. Research consistently shows that sexual interest and activity continue throughout life for many healthy adults. If you find yourself in conflict between personal or religious beliefs and biological reality, that tension is worth addressing with appropriate support. A counselor, a trusted advisor, or a healthcare provider who respects both your values and your well-being. You don't have to resolve every philosophical question, but you also shouldn't carry corrosive shame that demonstrably harms your health. Context 8. Balance and recovery. Your body at this age requires adequate recovery time between any intense activity. This applies to exercise, to sleep, to stress, and yes, to sexual activity. If you've noticed persistent heaviness or discomfort in the pelvic region, it may be that you're not allowing sufficient time for full vascular recovery between sessions. Blood flow to and from the pelvic organs needs time to normalize, especially as circulation becomes less efficient with age. For most men over 60, allowing 48 to 72 hours between ejaculatory sessions permits complete recovery. This isn't restriction, it's respect for your body's natural rhythms. Many men find that with proper spacing, sensation and satisfaction actually increase. Your body isn't a machine designed for continuous operation. It's a biological system that thrives on rhythm and rest. Context 9. Fertility awareness. This only applies if fatherhood is a consideration, but it's worth knowing. Sperm production slows with age, and frequent ejaculation in older men can temporarily reduce sperm concentration and quality. If conception is a goal, spacing ejaculation to every 2 to 5 days before attempts at conception tends to optimize sperm parameters. This is basic reproductive biology, not a moral statement about frequency in general. For men not pursuing fatherhood, this isn't relevant. But for those who are, understanding how your body's production timelines have shifted can make the difference between success and frustration. Context 10. Real connection versus digital substitutes. Many men have noticed something troubling: difficulty becoming aroused without visual stimulation from screens. They've become so accustomed to highly stimulating digital content that real-world intimacy, with its slower pace, emotional complexity, and human imperfection, no longer triggers the same response. This isn't about morality. It's about how the brain's arousal patterns adapt over time. When you consistently pair arousal with intense, novel, rapidly changing visual content, your nervous system calibrates to that level of stimulation. Real intimacy can't compete with that engineered intensity. And as you age, when real connection already requires more vulnerability, retreating further into digital content creates a self-reinforcing cycle of isolation. The pattern is modifiable, but it requires deliberate practice. Reducing reliance on artificial visual content, reconnecting with embodied sensation and imagination, practicing presence during intimate moments, and gradually rebuilding capacity for real-world connection. You're not too old for genuine intimacy, but you may need to retrain your arousal patterns to respond to reality rather than digital fantasy. Now let's talk about what research actually supports. The most evidence-based practice for male sexual health after 60 is pelvic floor training, commonly called Kegel exercises. Multiple studies show that pelvic floor exercises improve erectile function, enhance ejaculatory control, increase sensation and satisfaction, and support urinary continence, which is important as prostate health changes with age. How to do them? 1. Identify the muscles. Contract the muscles you'd use to stop urination midstream. That's your pelvic floor. 2. The technique? Contract those muscles firmly, hold for 5 to 7 seconds, then fully relax for 5 to 7 seconds. 3. Frequency: do 10 repetitions 3 times daily, morning, afternoon, evening. Takes about 2 to 3 minutes per session. 4. Progress gradually. As strength builds over weeks, you can increase hold time to 10 seconds. Why this works: increases blood flow to pelvic organs, strengthens muscles involved in erection and ejaculation, improves neuromuscular control and sensation, supports overall pelvic and prostate health. This isn't alternative medicine. It's mainstream physical therapy with solid research backing its effectiveness. Here's what the evidence actually suggests. Moderate, intimate activity, adapted to your body's changing needs, practiced within a life that includes social connection and emotional diversity, appears to support overall health for most men. Research on ejaculation frequency and prostate health shows potential protective effects from regular activity. Studies on cardiovascular health don't show harm from appropriate sexual activity. Research on psychological well-being emphasizes the importance of intimacy and connection throughout life. The key is context, not frequency alone. Are you maintaining meaningful human connections alongside private intimacy? Adapting your approach to your body's changing needs? Using varied strategies for emotional regulation? Paying attention to what your body is telling you about your health? Free from corrosive shame that harms your well-being? If yes, you're probably fine. If no, those contextual factors matter more than the activity itself. Your intimate life after 60 isn't about following rigid rules. It's about understanding yourself, respecting your body's changes, maintaining balance, and staying connected to life and other people. There's no shame in desire at any age. There's no failure in adaptation. There's only the wisdom of listening to your body, the courage to address patterns that aren't serving you, and the dignity of making informed choices about your own health. If this conversation was helpful, share it with someone who might benefit. Subscribe for more straightforward health information. And remember, your sexual health is part of your overall health, deserving of honest attention and respectful care. Your later years can be deeply satisfying when approached with knowledge, self-awareness, and balance.